in online advocacy efforts. So next slide. I am a breast imaging radiologist here in DC at Washington Radiology. Advocacy has played a central role in my career and social media, certainly for the past 5 or 6 years. I'm active on Twitter and Instagram. I have my BA in public health from Johns Hopkins and also worked on health policy during that time. And as a breast imaging radiologist, it plays a really central role talking about screening, protecting access to mammograms for my patients. And so you can see in my extracurriculars, I do a lot with government relations, economics, advocacy, and social media. So I don't have any conflicts to report, which I think is the next slide. Excited to be talking to you about this today. Ooh. So that's okay. So the outline, why use social media? We'll talk about some of the capabilities, the different platforms that you can be utilizing, how to use social media in a time of crisis and how it plays a role. And we'll go over several online advocacy efforts to try to give you a framework of how to be moving forward with it. So I think next slide might be my no conflict, so we can zip right past that. So, so businesses use, I think this is the old, but that's fine. So, businesses, we use social media a lot, and the reasons that they use it are for brand awareness, sales connections, and building company trust. We know that there are even a lot of businesses who have completely circumvented the traditional print, TV, and radio media and are only using social media to build their brand awareness and are quite successful. They're able to establish trust using influencers, using ads, using product placement online, and it works really well for them. So reason for businesses not to use it is inappropriate content. We know there's always pushback or blowback from bad campaigns, or just that one ill-timed or ill-phrased tweet can get a lot of blowback. They're worried about team participation. There is some time that goes into establishing a presence on social media, and so if you're asking for team members to participate, that can take time. And of course, we always feel that we have enough on our plate. So next slide. The same goes for us in medicine. We might not be building a brand per se, but we can use it to discuss issue awareness. So we can be recruiting support, educating, and empowering on issues. We can be building connections with the public, with our patients, with our peers, our fellow healthcare community, and also with other thought leaders, politicians, et cetera, in the community to be making those connections and be building patient and public trust. We all know, maybe not during the crisis when healthcare workers are considered superheroes, but outside of the crisis, we have headlines comparing us to thieves, there might not be a great overall public sentiment when it comes to physicians, so we can use social media to sort of try to combat that. But of course, HIPAA, and worry for professional blowback is one reason that a lot of physicians are hesitant to use HIPAA, or a reason that you'll get, maybe some scrutiny on some of your posts and want to be really mindful of what you're posting. You need to be mindful of hospital practice or school practices if you are still a trainee or in medical school. And of course, we're all always busy. And so how do you incorporate social media and advocacy into your practice or your education? Next slide. So social media has a lot of capabilities. I've already referenced a couple. We'll go over them in a little bit more detail, but it allows us to educate, empower, advocate, connect, and mentor. A lot of things that we all, as physicians or as physicians in academia, are already trying to do. And for me, a reason that I'm using it, as a breast imaging radiologist, I spend a lot of my day seeing patients and trying to discuss findings with them, discuss why annual mammograms are important, why we should start at 40, why they should be taking risk reducing steps, or talking to their doctor about genetic testing or high risk screening. And that's, you know, an amazing opportunity for me to be having those one-on-one discussions. Social media allows me to have those same discussions with an endless number of people, you know, thousands potentially, or more than that per post. And so, you know, it sort of takes that advocacy that we each have on a personal level and amplifies it. And so that's why, even though we might be doing all of these things on a daily basis, it's really important to consider the impact that social media can have in amplifying those efforts. So next slide. Pia, next slide.
It's a little bit slow.
Oh, okay, that's fine. So on the education aspect, so we can highlight issues, we can disseminate information. And those issues can range from just talking about a disease process. You know, for me, I'm going to be talking about these are, you know, the risk factors for breast cancer, or these are the types of breast cancer. This is why you should get screening. But for other people, they might be talking about diabetes and, you know, why you need to eat a healthy diet, why people consider plant-based, et cetera. As a radiologist, I like to, you know, define what it is that I do in the healthcare forum. You know, a lot of people think that radiologists just sit in the dark. So that's one of the ways that I've chosen to use my advocacy, talking to patients about procedure types. So you will see, you know, a lot of plastic surgeons or dermatologists on social media. And yes, it is a little bit of branding for them, but they're also getting out there and letting patients know what their options are. It's just another way to be advocating for your patients in your profession. And then of course, public health issues, which I'll give a lot of examples of later. So on the next slide, we can talk about empowerment. And again, for me, that's empowering my patients to be taking those risk reducing behaviors, empowering my patients to take charge of their health. Or in a completely separate STEM, I do women and diversity for both the ACR and Women in Medicine here in DC. And social media is a great place to be reaching out to those underrepresented minorities, women in medicine, women in STEM, working on workplace equality, raising those issues, bringing people together and finding solutions to some of the problems that we see in medicine and in the workplace. And so it is a great place to be creating community. Next slide. So of course, we're here to talk about advocacy. And, you know, it's not just about advocating for our patients. We can also advocate for our profession and for public health. So for me, it's, you know, maintaining access to screening mammograms. In terms of our profession, there's a lot out there, whether it's the Physicians for Patient Protection, where they're, you know, trying to protect MDs and DOs versus some of the other types of healthcare providers out there. Surprise billing legislation. I personally have been involved in a lot of advocacy efforts. A lot of the MSDC efforts, for example, the physician protections that they are trying to create during this time of crisis, when we know that their healthcare workers and physicians have been under fire. It's a great way to be recruiting support for that type of legislation. And for public health, whether it's gun safety, screening, vaccines, and we'll see some examples of those later on how social media really allows us to be vocal advocates. Next slide. It's a great way to connect. I've already talked about the ways that it allows us to connect with our patients, with our providers, with the public. It also allows us to connect with legislators and thought leaders. So I'll give an example later, but you know, through a single tweet, you can be tagging all these people that, you know, they might never take a phone call or know that you called, or even when you meet with them, you know, you're just one line on an agenda. But someone is going to see that tweet, and oftentimes you will get a response, you'll get a like. I have gotten messages, you know, direct messages, or even, you know, follow-up based on tagging someone on a tweet. It's not going to happen all the time, but just knowing that you can actually directly access a lot of people through social media. You can also find your tribe and find your voice. So, you know, whether it's women in medicine or a particular ethnic group, that's gathering. Plant-based physicians is a really big one. Dr. Neil Bernard, who's part of MSDC, has really brought a lot of us together who are interested in plant-based nutrition. So really all sorts of different communities that you can find on social media, as well as, within your own specialties, for me as a breast imager and as a radiologist. So next slide. And then that also allows for mentorship opportunities. So I know many of us mentor in our own roles, whether we're in private practice or academia, but you'd be surprised how many messages those of us who are active on social media do get, whether it's from pre-meds who are interested in knowing how I found a career in radiology, same for medical students, residents who are asking me about practice opportunities, fellow women in medicine, underrepresented minorities, and a lot of us get a lot of messages from foreign medical graduates on how to break into the medical system. So, even if you're not tweeting about these types of things or posting about these kinds of things, you do, find a way to mentor and sort of advocate on that personal level. Next slide. These are, if you are just getting into social media, some things to consider. You want to be posting credible content, obviously looking into the legal ramifications of the content that you're posting. Again, not posting any HIPAA. It doesn't mean not just posting, I saw Jane Doe today, but if you have a hard case and you go online that day and you say, wow, I had a really crazy case, and that patient sees it, or someone related to that patient sees it, and they know that you're talking about them, it becomes easily discoverable. And so you have to be really careful. Even if I do say, I've seen cases of XYZ, I wait months after and am extremely vague in discussing any of those types of things. Obviously, you want to be considerate of your practice, your medical licenses, your patient privacy, and your own privacy, and then obviously things that are ethical. So a lot of physicians are influencers on a larger scale, and you have to be really mindful of the communication laws and the ethics when it comes to financial compensation. So next slide. So the social media platforms, we all hear about these. Twitter, of course, the president is active, so everyone knows about Twitter these days. Instagram, Facebook, the original, actually not the original, MySpace I think was the original, right? But TikTok and LinkedIn. So I'm very active on the first two. I use Facebook a little bit for community, and then I'm not as active on the other two, but we'll still talk about them a little bit. So next slide. So again, Twitter, limited text, and it's anywhere from 140 to 280 characters, depending on the type of account you have. But you're able to quickly disseminate information. One of the great things about it is it allows sharing links. So it's actually really great for medicine and academia in the sense that you can be sharing seminal work or a new paper, sharing articles and graphs. And so really great for sharing information. And it's a really great place to create community. Things like hashtag MedTwitter or hashtag cardio Twitter are just some examples. Hashtag doctors on social media, to be finding your community, to be able to establish a presence on social media or connect to other people who would be of interest to you. You can also search hashtags of your interest. So for me, it would be, hashtag radiology or hashtag public health or hashtag breast imaging. But it allows you to sort of very quickly establish your network.
She doesn't write back, then I'll do yoga with Adrian.
I think
so.
I think a couple people have unmuted. And then again, as I previously mentioned, it's easy to tag legislators and thought leaders or news outlets. It's a way that I've gotten some, been quoted in articles and been quoted on other news sources because of a tweet that I posted that someone on Twitter saw. We know single tweets can go viral, so you don't have to be a big account to, be having a big impact. And then retweets allow for amplification of a message. So on the next slide, I just have a couple examples of things recently where I was reposting, an article from a fellow physician on how physicians need protection. On another slide, in a way to try to encourage other practices around the country to halt screening mammogram as the recommendations that we've received from our governing bodies. I shared an article about how unfortunately a mammography tech had passed from COVID and how we really needed to be protecting our tech. So that's an example of where I was advocating, in the time of COVID. Or this, Alok Patel, he's a physician who's really active in media medicine, and retweeting and amplifying how he's saying we should be protecting trainees during this time. So on Instagram, it's known for it being picture driven, it's picture content, but it actually does allow a lot of written content. So instead of being limited to those 140 characters and having to post multiple tweets to get longer points across, you can use any kind of picture. So it can be of yourself, it can be of the typical pretty travel pictures, or it can be, sort of a feeder question. It can be something that is a jumping off point. And the same way that you can create that community and search and engage on Twitter, it's similar on Instagram. You can be searching for hashtags to find community that you'd like to follow. You can join hashtag campaigns. So those are really popular, and I'll be showing some examples of those. And those can allow you to engage with other physicians or the other types of community members you're looking for, and allow you to amplify your voice. And again, a lot of really community-specific groups on Instagram, whether it's doctors on social media, women in medicine, etc. A lot of plant-based physicians on that one as well. So on the next slide, we'll talk about, and I have plenty of Instagram posts coming up, so I'll show you some of those. So Facebook, I don't personally have a professional website, but what I use Facebook for is the physician group. So I just took a screenshot of some of the physician groups I'm part of. And listen, I'm not looking at these every day. I'm not, participating in them every day. But through these types of communities, physician side gigs, physicians for patient protections, Pinnacle Women in Medicine, et cetera, you're able to establish a community. And through some of these, both for physicians for patient protection and through the physician side gigs, there's actually legislation that has come out of those groups. So currently, Nisha Mehta is a physician. She's actually a fellow radiologist in North Carolina who created some legislation that's aimed at protecting physicians during the COVID crisis, whether it comes to debt relief, malpractice protection, some financial relief, et cetera. So these aren't just, the typical what you think of Facebook, posting pictures and connecting with family. Facebook, and again, all of these other platforms really do provide a platform for community and advocacy and the other capabilities that I discussed. If you are someone that uses your own Facebook in a professional capacity, Facebook Lives are a great way to be reaching out to community members to whether it's advocacy or education or however you choose to use that platform. So on the next slide, TikTok is for not even millennials. I think what are they now? Gen Z or something, but it's typically a younger audience. So there are a lot of adolescents, college age kids who are using that, but a lot of physicians have then joined just so that they can reach those younger members. So as an example, when everyone was out on spring break, a lot of people jumped on TikTok and were telling them, how they needed to help flatten the curve. Vaping has been a really hot topic on TikTok, trying to reach out to the younger crowd and tell them not to vape and why it has an impact on their health. And those videos go viral very, very quickly. So I am not on it, but it is a great social media tool that a lot of physicians and healthcare workers are using. And then the last one, LinkedIn, I think we all know that it's kind of a CV online. but it is another way to be connecting. It's a really good way actually to connect to news outlets and industry leaders. So I don't use it for advocacy per se. I use it a little bit more for connections, but that sort of plays into how it helps in my personal goal for advocacy. Next slide. So, of course, we're here to talk about how it plays a role in the COVID crisis, and it certainly has. Excuse me, needed some tea. So, in this day and age, we turn to social media a lot for news. It's not just, a place that we're looking at puppy videos or I don't know what other people like to access online. People are actually using it for news and for live, real information. And social media for me was one of the first places where I was realizing that we had a PPE shortage. Weeks ago, when my own physician friends with whom I'd connected started pleading for protective equipment, and people were placing, their own pictures online showing the types of things that they were having. We've seen trash bags, we've seen ponchos, we've seen all sorts of, improvised but completely unsafe equipment. And so that was has been one of the biggest advocacy efforts, and has led to, a little bit more government action and placed the pressure. Flatten the curve. Again, whether it's TikTok, Instagram, Twitter, we've all seen that hashtag, we've all heard it. And it's been trying to educate the public on why it's really, really important to be participating in these efforts to help flatten the curve. Stay home, save lives is a big one that we've seen. And again, just trying to give a face to medicine, the healthcare workers who are all at work and asking everyone else to stay home. And because we aren't able to see our own patients, it's been a way for us to reach out, encourage them to stay healthy, to reduce risk. We know that the underlying healthcare disparities are exacerbating the COVID response in some patients. And so, again, just trying to encourage healthy behaviors. And then what I didn't include, but what is also important is how the advocacy for physician and healthcare worker protection has really taken off during this time. Even though there are groups that have existed, Physicians for Patient Protection, et cetera, in trying to protect our profession, those efforts have really been amplified during this crisis, as we see doctors and frontline workers who are really in a lot of personal and professional danger. So on the next slide, flatten the curve. Again, I talked about, those people on spring break, and so just trying to stress the importance of staying home. So on the next slide, this was just my own Instagram post on an example of me encouraging people to stay home and using the hashtags like flatten the curve, social distancing, coronavirus, pandemic. And you can see it got a lot of response, people responding on and amplifying, and it got a lot of shares. And these are the types of things that, really help get that advocacy out there. On the next slide, I think I talk about the stay home, save lives. So on the next slide, there's a picture of, and there were so many of these where, you got groups of healthcare workers just trying to add give a face to the people who are on the front lines to really say, we're here and we need you to stay home so we don't have to be here. These people, are risking their lives on a daily basis. On the next slide, I think the Get Me PPE, again, this is probably the biggest advocacy effort talking about how physicians need protection and really working as a catalyst to spark government action, private industry action, and honestly, public action. So from this, we saw, factories being converted even prior to government mandates. Of course, it did help the government make the decision to move forward with mandating some of this production It encouraged private citizens. My own mother-in-law was sewing masks, and learning how to put air filters and vacuum filters, et cetera, into masks. So this is probably the biggest one, the hashtag Get Me PPE. And on the next slide, I put together for my own followers some examples of ways that they could participate. So some organizations that were helping recruit masks, recruit donations, or help direct supplies. But if you were to go on Instagram or Twitter and type in hashtag Get Me PPE, or even to type in PPE, there are endless accounts that have been developed that are all trying to do the same thing, that just have existed in this time of crisis to try to organize masks and gowns for healthcare workers. So on the next slide, on some education efforts, reaching out to patients during this time, to patients, in addition to knowing about hand hygiene, are wondering when they need to call their doctor. We need to stress the importance of health maintenance. Now that they have limited access to us, health maintenance is more important than ever. And just communicating to patients, that, like for me, as an example, we stopped screening mammograms almost a month ago, and stressing that screening mammograms remain essential, just not urgent in a time of crisis, and clarifying that issue, because we don't want the messages to get mixed and for patients to think that their normal screenings or normal healthcare isn't important anymore. So on the next slide, this is just a quick video. We don't have to watch the whole thing, but this was an example of, and I don't know if it's playing, but this is a video that was made through the bureau president of Brooklyn, who is a big plant-based advocate, and he got about 50 of us together to talk about how, if the audio is not playing, then that's fine, but wanted to talk about how healthcare disparities have played a role in how COVID impacts individual patients. And he gathered all of us together to talk about diet, exercise. Of course, the focus was on plant-based diet. Everyone in this video is a plant-based physician. And so just an example of some of the advocacy efforts. So we can probably move on to the next slide. This is one that a lot of specialty groups have done. I organized this for breast radiologists. I've seen similar ones for the fertility community, for the GI community, eye doctors, pediatricians, et cetera, just telling our patients that we're here for them, giving sort of streamlined recommendations based on, our own individual fields. For me, saying, screening mammograms remain important, but, here are some of the things that you could be doing: limit alcohol, continue breast exams, et cetera. And educating patients on when to call their doctors, because we know there are still emergencies that are happening. There are still actual urgent healthcare needs during this time, and patients need us to help them understand what those might be. So some online advocacy efforts outside of the time of crisis, and we can quickly go through these. So next slide, Rads Have a Face is something that radiologists have been doing. We know that we have a PR problem, that people think we're stuck in the dark. A lot of patients and even a lot of fellow physicians don't realize that we see patients. That is something that comes back, for example, through surprise billing, when patients are getting a name that they've never seen and a bill. So just trying to get out there, put a face to radiology, and let patients know that we are here for them, but also for medical students and for pre-meds, recruiting them to our fields, letting them know that, what the options are within radiology, trying to recruit women and underrepresented minorities as well. So the next slide is just an example of one of those campaigns, talking about how we're not just black and white, but, we do a lot of other things as well. So Verify Healthcare, that's another one that's really important online. And actually, this campaign did prompt the creation of the Association for Healthcare on Social Media. So we know that there's a lot of quackery online. We know that Gwyneth Paltrow or the medical medium, celery juice, et cetera, gets a lot of attention, and we need to redirect patients to actual evidence-based healthcare and away from the pseudoscience and the voodoo and quackery. And so we created the Verify Healthcare campaign to try to create transparency and show the public where they should be getting their information from. So on the next slide, this was just my personal post just talking about why I would be a person that they could turn to for, breast health, for breast imaging, et cetera. And the American, the Association rather for Healthcare and Social Media, that's a group that was started by physicians who are, and some non-physicians, but healthcare providers who are all active on social media and are helping establish and have helped to establish over the last couple of years some guidelines for those who want to enter the social media space, working on communicating with hospitals and practices. So if you are someone that wants to get started and doesn't know, how to navigate that space, they're someone that's really good to turn to, and they could help facilitate that type of communication with your practice. Of course, their first conference was supposed to be in May, and that's been put off for now, possibly going to be virtual, but something to look out for. Next slide. Practice what we preach. If we're getting on here and we're having all this education and advocacy and trying to make a difference, it's important to show that we as physicians also take our own advice. So next slide. So this was just a campaign that was geared towards showing patients that we do practice what we preach. And individual physicians were able to say that. This is my lane and this is our lane. So you all might remember after one of the many unfortunate school shootings that the NRA made a comment in response to, I believe, a trauma surgeon or an ER physician who was commenting on school shootings and how it affected, her life and the lives of her patients. And the NRA told us that doctors needed to stay in their lane. So this was our response, showing that gun safety and control is a public health issue, not a political one. And it is something that's very important for those of us in healthcare. So on the next slide, this was a really powerful campaign that was all over Twitter and Instagram and really got a lot of participation from physicians across the spectrum. So for me, I could say, what it was like to work at a level 1 trauma center at Parkland Memorial Hospital in Dallas, and others were contributing in their own way. And so just again, showing that a way to advocate for a public health initiative. Doctors do vote. This was just, you can breeze right through this one, just showing that doctors do participate. Next slide. In voting and how it's really important, and trying to encourage others to vote. And yeah, next slide. Another one that's really important, and I just wanted to comment on this one. So vaccines are incredibly important. We all know that as physicians. And the anti-vaccine movement has contributed to measles outbreaks around the world. So we wanted to, again, fight the pseudoscience and encourage others to give vaccines. So if you go to the next slide, I was traveling during this time, so I chose to use travel as an example of how the measles outbreak spread. So in addition to using hashtags like don't go viral or vaccine saves lives, I actually chose to use some of my hashtags targeted towards the travel and lifestyle community. A lot of Instagram is, travel pictures and go travel and, wanderer or something like that. And so by using hashtags that were targeted to that community, I reached out to an entirely new segment of the population, not just the typical people who might be accessing healthcare information. So that's just something to be mindful of, is when you're doing your advocacy efforts, think of ways that you can get the most amplification, the most reach. And also when you're talking about hot button issues like gun safety or vaccines, be prepared for some blowback. Don't interact with internet trolls, and just be really mindful of the type of content that you're posting and how to remain impactful without being controversial. Screening, of course, is really important. So as I said, that's something that I post about a lot, and you can move to the next slide and just show that. So this is something that I brought physicians from around different specialties, whether it was GI doctors talking about colonoscopies, dermatologists talking about skin checks, ophthalmologists talking about diabetes, eye checks, or optic melanomas, just talking about, again, educating patients on why it is that we get these different screenings, because honestly, sometimes patients don't understand why certain screening intervals have been recommended, or really the impact of their annual screening. Next slide. This is one for how I was saying it's not just for medical, it can also be for workplace and gender equity. So this is one that we did talking about equal work, equal pay. And this picture, of course, I was trying to be provocative, so I got my money out. And then I think the final example that I've given was another one that had a lot of impact on patients over profits. So for surprise billing, that was being discussed in the spring, summer, and fall of last year, insurance companies were looking into legislation that would really put profits over patients, and certainly over any physician interests. And so a group of us online on social media, in addition to our normal advocacy efforts, got together and made a video that I'm not sure if it works in this, but through this video, we were able to get reposts through multiple specialty societies. We were able to tag legislators. We were able to create an entire Hill Day, Capitol Hill Day, and meet with legislators on this issue. And really, this was a great way for us to be able to amplify our efforts. So just an example, and again, I don't think the audio is sharing, so we can stop. But just another example of a way that social media creates community, is a great space for advocacy, and really a way to amplify your own efforts. So, yeah, I mean, I wouldn't normally be considering making videos about benchmarking, but obviously this was a great way to do that. So I think that's about it. So obviously, if there are any questions over what we covered, and then that's how you can find me on Instagram, Twitter, and by email.
Thank you, Dr. Malik. I'm going to give you a chance to have some of that very important tea, since you've been speaking. Thank you for that content. I also want to mention that the surprise billing video was shown at the OSMAP meeting, but prior to the AMA, one of the AMA meetings. So it reached a very wide audience. So that's the power of social media. I'm going to, and by the way, for participants, please put your questions in the Zoom group chat. That's the easiest way for us to get to them. Also, you can email me at hay@msdc.org. And while we're waiting for questions to come in, Dr. Malik, I want to ask you a very simple question, which you've partially covered in this presentation. With so many different options for social media, how do you decide which service works best for you, or which platform works best for you?
Yeah, that's a really good question. So I think sort of exploring the space, deciding what's important to you, and what kind of content you want to be creating and delivering is important. So there are a lot of physicians, as an example, who are very active on Instagram. They like that they can get a lot of content out there through the words and through the pictures, and they don't function as well on something like Twitter, which really limits your capabilities, and vice versa. There are some people who like just getting those quick tweets out and not having to deal with Instagram and some of the maintenance that might take, because Instagram sometimes your followers do like, lengthy posts and pictures and stories and a little bit more engagement and action. So I think you need to know what it is that you're trying to achieve, your level of participation and interest or engagement. And then just exploring the communities and seeing where you think you'd best be served.
All right, we have one thank you for the presentation, which I'll echo, and we'll echo again at the end of the webinar. But a very good question just came into the chat box. So I'm new to social media. Is there a platform that you can post to all pages or accounts at once? I struggle with trying to post quickly to all of my platforms. Do you have any recommendations?
That's a really good question. So I don't personally use any services, but there are a lot of scheduled services that you can be that you can subscribe to. I think Hootsuite is one of them. There are several. I did not prepare for that question, but that is a really great one. But if you do look into it, there are schedulers basically that they assist in disseminating your information to whatever platforms you choose at whatever specified time. Because yes, we are all busy professionals and don't have time to be tweeting. Somehow our president does, but we don't. So, so we need to, be mindful of the time during which we, the amount of time that we dedicate. So there are a lot of services out there.
I will say Hootsuite, the free version, is pretty good. It's limited in terms of the number of accounts and the number of posts you can pre-schedule. For Twitter, TweetDeck as well is an alternative, and there's a number of others that you can use for free. And if you just type into your favorite search engine, something like Hootsuite alternative, a lot of those will come up. So while we're getting some more questions in the chat box, I want to ask you, Dr. Malik, about social media and your employer. One thing MSDC did recently was the board passed a statement about physician rights during COVID-19, and one of those rights was the ability to speak out on social media and to the media, during this crisis to get information out. However, there can be conflicts with things you post on social media between you and your employer. How do you navigate those rough waters to ensure that you're getting information out to the people who need it, or you're participating in movements that are important without getting yourself in too much trouble, getting fired, losing your job?
Yeah, no, that's a great question. And I think before establishing any online presence or professional online presence, you really need to be establishing and understanding what the rules of your facility or school, et cetera, are, and making sure that they are in line with what you are doing. As an example, there are a lot of physicians who are large enough accounts that they are brand ambassadors for certain companies, whether it's a scrubs company or a white coat company or something along those lines. And you need to make sure that your contract allows for that. In the same way, the kind of information that you're sharing. When it comes to the physician protections during the time of crisis, obviously we've seen that some healthcare workers and physicians have been terminated, although hopefully that won't actually go through, but were up for termination based on speaking out. And in this setting, it's obviously incredibly important that they were adding transparency to this really important issue and the crisis. But I think outside of a time of crisis, you really want to be mindful of your employer or your school and their policies. And for those who are in training or certainly, in school, you also want to be mindful of the impact it's going to have on future applications for medical school, for residency, fellowships, and your first private practice. So obviously social media is now more common. And so we know that there are a lot of people who are on it, and it's a little bit better accepted, but you're still going to have some resistance to it. And you need to be able to frame it in a way that is I guess, palatable. And so just making sure that your online presence is in keeping with that.
Great, thank you. And I've been getting texts while we were doing this praising the presentation, so I wanted to relay those as well. Can you talk a little bit, you touched on this, and I apologize, I forgot what slide it was, but dealing with people who disagree with you. You know, it seems like in social media, there's people who disagree with your position, and then people who are trolls or who tend to harass people on social media. And we hear a lot about the latter, but can you talk a little bit about how to deal with respectful disagreements on social media, as well as how to deal with trolls and less respectful, to be, you know, somewhat polite disagreements?
Right. Sure. So I think, number one, anything you post, be prepared to back it up. And so you should only be posting things that are evidence-based. I mean, I hope that goes without saying, but just to reiterate, you should only be posting evidence-based content. And if you are posting something, for example, during COVID, there has been so much that's just coming out daily that are preprint, that are, you know, studies with a really low sample size, et cetera. So just clarifying, if you are posting something that might not be to the level of medical soundness that you might normally post, it's really important to say, this is a small study with these limitations, but it shows us X, Y, Z. And then be prepared for any blowback, and decide if the comments that you're getting are, listen, I hear what you're saying, but X, Y, Z. You can choose to engage in a respectful, informational manner. I hear that you're saying this, but this is why I say this, or this is why the guidelines say this, or this is what the evidence shows. If you're getting, you know, like on these vaccine posts or on the guns or whatever, if you're getting the really aggressive responses, I would not engage. You can hit that block button in under a second, and I would not hesitate to do that. And I don't. I have hit the block button, you know, for a lot of women especially. You get a lot of, you know, I don't know if they're bots or bored individuals, but do not hesitate to hit the block button and keep moving forward. One thing that we have seen, I don't know anyone personally who suffered from it, but I've heard about it in some of the doctors on social media and other physician groups on Facebook, is people who are particularly vocal about vaccines or another issue, who have then had people blow back to them on Yelp reviews or you know, whatever other review sites. So if you do feel like you're going to establish a particularly controversial online presence, to maybe be seeking legal counsel before you do so.
Great, and I'm going to break the rules and unmute one participant because this person cannot type in the text box. So let's see, Dr. Pineda, MSDC President, can you ask your question?
Sure. Can you hear me?
Yes, we can.
Okay. Thank you. I'm sorry, but I'm driving. I didn't want to miss your presentation. Thank you, Dr. Malik, for this informative slides, and as always, very interesting. So one of the main things that I think a lot of doctors have, and that I have, is we talked a little bit about posting something that is controversial, what to do if someone doesn't post something that is not good. But also, I'm afraid of a patient posting something that is not true, or they just left with a bad impression from the office, and then it becomes viral. Also in, you know, Twitter, social media, so or Facebook. So any of those, is there anything that we can do about it? Or, you know, can we delete a post from someone? You know, things like that, that it can help the community maybe get more involved with their patients. I think it's a great tool, but there's also some things that we are afraid of using it.
So I think you cut up a little bit, but I think the question was what to do if a patient posts something negative online on one of the platforms. And that's a really great question. So a couple of different things to consider. If they tagged you or your practice, you can untag yourself, or you can block the ability for anyone to tag you. For example, on Twitter, a lot of accounts are unable to be tagged in pictures. They can be tagged in posts, but not in pictures. You can report I think any post on any platform as inappropriate, as spam, as abuse, etc. There are a lot of different options, and they are pretty responsive to those requests. And certainly one report might not be as powerful as, for example, if someone did post something negative about XYZ practice, if you were to get a large number of people, recruit a large number of people to report a post, it can be removed or at least temporarily suspended while it's being investigated. As an example, this is not quite what you asked about, but as an example, there was a physician who was posting just completely bogus COVID information, and those of us in the medical community he has a really large account, and it could really have had a really large negative impact with that level of misinformation. And so we all got together and we just temporarily had his account suspended on Instagram. Obviously, that's not something that we would take lightly. It was a collective decision based on, again, the level of misinformation. So his account was temporarily suspended by Instagram. And so I guess that the same could be said for if something is negative and untrue, or could be resolved through a different avenue.
Great. I think we have time for one more question, and we have a question on the chat. Can you recommend some good online resources that will give a good tutorial on different social media platforms and how to use them?
That's a really great question that I don't necessarily have an answer to, but I can say that Doctors on Social Media, through Dr. Donna, her name is blanking. I'm blanking on her name right now, but she started both a public and a private, like where you have to get an invitation to join or you have to request to join, group on Facebook. And through there are a lot of resources. And I do believe they might even have a website. And so through there, you could get a lot of resources and information on everything from, Instagram and Twitter to starting a blog to starting a podcast, because podcasting is another way to be getting out your message these days. And then the AHSM that I mentioned, the Association for Healthcare and Social Media, I'm not affiliated. I am a member, but I'm not affiliated. I have no financial incentive for you to join, but they are a great resource. Hopefully their first conference does go through in some virtual format, and they exist to help others be able to establish a meaningful, powerful, but also ethical and medical legally safe online presence.
Great, thank you. And it probably doesn't hurt to ask for advice from other people as well who are active on accounts. So based on the information you've given today, it seems like there's a lot of people out there willing to help, including here us at MSDC. So and because we are close to 11 o'clock and it looks like the questions have been asked, I'm going to say it's probably time to do one final thank you to Dr. Malik. It would not be a social media webinar without recommending that you say thank you to her on her social media accounts, especially Twitter. If you need example, I know I just posted something, but thank her on social media, but also thank her in other places. And we'll say thank you very much for a very informative presentation today. Follow her on social media, follow MSDC on social media. We're on Twitter, Instagram, Facebook, YouTube, and I think that's it. But anyway, thank you all very much for participating today. Thank you again, Dr. Malik, for presenting, and be safe on social media out there, everyone.
Thank you.